Okay, we have a case sent in for tooth number 9. This tooth looks to have not looks, it does have a post in it. I have some questions on it. We see a couple of different posts here, so I don't know if there's two posts or I don't know exactly what's going on here. Here is what was sent to us. This patient is a 75-year-old male. Health history is normal, and number 9 is broken at gum line. The only thing holding in place is the post. My goal here is to place implant after atraumatic extraction and attempt to place temporary crown, screw retained, out of occlusion as well. I was certainly prepared for flip or Essex appliance or just doing a bone graft. I want you to review the design and let me know if you think this case can be done like I mentioned above. Thank you for your time and look forward to some additional training and the abutment workshops. So I do look forward to seeing this person in the future. So let's go ahead and take a peek. Okay. So when we do immediate implants, we have several different things we need to look at. And one of the things that we cover in our course number 3, anteriors, immediates, and grafting, is um, exactly what to look for. So one of the main things, the number one thing that we need to be relevant of is the buccal plate. Where is it? What's its condition? What's going on with it? Number one. Okay. Number 2 is going to be stability of the implant, the ability to get it in, have it stable, and then have a provisional put on it. And then we look at the tissue type, location, many different factors beyond that. But what I want to focus on right now for this lesson is I want to look at the buccal plate. So if we take, let's go here to that panoramic view and let's kind of get to our implant here, okay? And there we are right there on our implant. And what I'm doing now is I'm going to use our image slicing tools here. And what I'm going to do is I'm going to slice this to be along the long axis of the implant, just like so, so I can see the extent of the implant, the tooth, sorry, a little bit better. And then we're going to go along the long axis of the tooth so I can see the tooth a little bit better. And now I'm going to go ahead and make my lines disappear. So what I'm looking at here is I'm looking for my buccal plate, and what I'm concerned with here is now it could be because of the scatter from the metal in the tooth, the post in the tooth. So if this tooth does come out in the future, I would say maybe a scan without the tooth in the post, sorry, without the restoration in the post would be helpful. But the first thing I'm looking at is I do not see a firm sound buccal plate. So, if I were to take a guess, I would have to assume that my buccal plate ends right here. Maybe comes to about right here. And when I see something like that, a lot of red lights go up on me. This can become a very aesthetic disaster or an implant disaster. So if I am not certain of where my buccal plate is, this is definitely a case for pre-implant grafting. Take the tooth out, graft the case, retain the tissue. We have to graft and remain a new buccal wall. So, this is certainly not an easier case. Connective tissue grafting is a possibility. Tissue biotype is going to play a role in this. So I would be prepared for, in fact, you can kind of see it looks like a buccal plate disappears after that spot right there. So again, it's very difficult to tell. Maybe we see a buccal plate up to there, but it's just hard to tell. So the first thing is where is that buccal plate? How does it exist, and how does it affect our ability to place the implant? And I'm just concerned that either we don't have a buccal plate or we have a very thin buccal plate. So I would be very concerned about placing an implant in this site. Now, if we can, let's just pretend that buccal plate issue is not there. The other thing I noticed about the plan is that the implant is not deep enough. We want our implant to be 3 millimeters below our proposed gingival margin, and then when we take out a tooth, we need to expect about a millimeter of bone loss from that. So this implant would need to be placed probably somewhere in the ballpark of right here, assuming again that there is a buccal plate. So there are some issues going on with this case. I would tread lightly on this particular case personally, um, just because there's some unknowns right here. And again, that could be because the buccal plate doesn't exist. It could be because of the scatter from the metal post here, but there are many different things going on. So I personally would not plan on placing an implant here. Thank you.